Hey friend, guess what? I finally got a hold of ADHD meds for the first time in about 3 months. My husband and I both, and so we are excited to kind of get back to a more normal functioning level. But I wanted to share a couple things with you. First of all, it was not an easy journey getting our meds again. Our issues surrounded supply chain issues, changes to medications and insurance, and we had to just keep pushing and keep trying until we found something that worked all around. So I just want to encourage you guys to keep going. If you're struggling to get a hold of medication, whether it's a supply chain issue, insurance issue like us, or your doctors are not believing you and not seeing that you have ADHD, or not willing to refer you to somebody, or telling you just simply cannot have ADHD for whatever reason and are denying you that opportunity, or if maybe you have some familial or social pressure that is discouraging you from trying to get medicated because of the stigma of stimulants, misinformation, whatever it is, or if it's because you're simply experiencing those feelings that are common with ADHD and depression and anxiety, and you are struggling to advocate for yourself and put yourself out there and get treatment. I just encourage you to not give up and keep trying. I have siblings in some of those situations, and it's frustrating and hard, but worth pushing for the chance to experience life the way we should be. And it's so hard to know that when you've never tried it, or you've been off it for a really long time and you're a whole different stage of your life, and you've only had it when you were in elementary school or something, and so now life is very different, and it's sometimes hard to see how it can help. And of course, when you don't have a official diagnosis, it's hard to feel confident enough to advocate for yourself and believe that will truly help. However, it's just one of those things that you don't know until you try it. I was talking to my husband, and he's felt like there's never been a problem in his life. He's felt relatively smart and gotten things done, and it never looked like there was something glaringly wrong in his life from externally or even internally for himself. I, however, felt like there was something wrong, but again, externally, there was no signs, not many, or not any hard-hitting characteristic ones that everybody would pick up on. But now he's on this ADHD medication, and he's at university taking classes, and it is just mind-blowing to him to see such a difference. Without it, his workload, his schoolwork is just all-consuming, and it takes kind of all his time. He's also working as well, so all his time pretty much is spent with school or work, and he feels like his pace is so much lower when he's not getting help of an ADHD med. And when he is on it, he can focus and get things done, and he said, it's so awesome. I think of things that I have to do, and I just do them. I don't procrastinate or weigh out, okay, do I have the motivation to do it right now? Maybe I'll do it later, or like, do I have time? He just gets it done, and it feels so good. And he was telling me he feels like he's cheating, like it's a shortcut that he shouldn't have access to, and he feels guilty almost having this. But we keep reminding him that is not the case, that he should never feel badly about taking medication that has been prescribed for you from a doctor and that your body needs. I tell him that he's basically leveling the playing field and getting to be where he should be. And there's such a stigma about stimulants and ADHD meds, but it's really just like any other medication. There's genetics where there's a deficiency in something, and you just gotta take your meds for that. No one would judge you for taking your medicine as a diabetic or something. So there's a lot of misinformation out there, I think, and a lot of stigma that is not helpful and is not accurate. So I'd say kind of quiet all those outside influences and noise, and just focus on yourself and what you think your body needs, and just really get in a relationship with a doctor, and a good doctor, because there are some doctors who don't believe you or will dismiss you for what reason or another and think, oh, it's just this trending thing that everybody thinks they need ADHD meds, or you're a college student, you're just trying to get by easier or whatever. But there are good healthcare providers that will value what you have to say and see the truth in that and help you, and you just gotta keep pushing, keep trying, and all for the sake of having a better experience and daily life that's not so that's less frictionless and difficult, and there's less struggle, and it really unlocks new potential, new opportunities for you when you're not just getting by with the bare minimum and just surviving and keeping your head above water. So I hope this helps somebody. Don't forget to click on this next video to learn more about mental health and ADHD and all the things. Thank you so much for watching.